TikTok is asking me where I am. I am in the bedroom of my cottage, Kelly. Yeah. So welcome to my little slice of heaven. Okay, Tarek, just message me on Restream if we are good to go, and we can start up again. So,
should we maybe go back again?
yeah, let me just make sure everybody is there. I want to make sure Tarek is okay. Whoop. Let's make sure that everything is working. Can everybody see us on the various platforms? Imogene, we're probably going to have to do this again next week now.
That's okay. Not a problem.
We are all set. Yes. So we're good now. That's fantastic. To those of you who are rejoining, my apologies. We had a screw up with technical difficulties there. So thanks for joining us. We have Imogen from Inception Life Bank with us. And we were just talking about the amazing work that they do with stem cells. And this is what we commonly refer to, or what you usually hear of, called cord blood banking. So cord blood banking is where at the time of a baby's birth, you can actually save either the stem cells in the umbilical cord, which come in the blood, or you can actually save the tissue from the cord itself. And that has a different type of stem cells. So Imogen was just explaining that the cord blood cells can be used for multiple types of cancer, leukemias, neuroblastomas, and so on. Whereas the cells that are in the cord itself, in the tissue of the cord, are more, we call them mesenchymal cells, but they can be used more for things that you were just mentioning: spinal cord injuries, heart attacks, heart injuries, that kind of thing, tissue regeneration, right? So I think that's pretty awesome. And you said 50,000 people have now used this. Is that correct?
That's correct. So over 50,000 transplants have already been performed using these cord blood stem cells. So again, if families have these stem cells stored, a lot of transplanting doctors and treating physicians would look towards using that as opposed to, going through the whole process of retrieving bone marrow, for example. So it just depends on which particular source is readily available at the time.
So if I save stem cells for my hypothetical children, all of them are way too old for me to save stem cells. And let's say I do it for my grandkids. My grandkids want to access their cord blood in the future. How complicated is that process?
So for us, and for most blood banks, I would imagine, but for us, it is a pretty seamless process. So up until the child is 18, it's essentially the mother's sample until they become age of majority. So they can have the decision on where it goes, if it's going to be used for the child within that 18-year period. But once the child is age of majority, we send some documentation just letting them know that we still have their sample stored. You'll be able to make the decisions on whether to use them, where, who is going to use them, if it's either yourself or they want to use it for their sibling, for example. They would just need to liaise with us and our dedicated cord blood release team, and we would send appropriate documentation to their treating physician, transplanting doctor, and we will release and transport the cord blood sample or cord tissue sample to them wherever they would need it. So not only limited to here in Canada, but also worldwide. So we have experience in that.
So if we save our stem cells in Canada and you move to, let's say, Europe, you guys can ship to Europe?
Absolutely. Yeah. If it's going to be used for a treatment or to be part of a clinical trial even, we will release and transport these stem cells to you at no extra cost.
And is it like do different countries have different regulations with regards to use of stem cells, or because they're yours, it's pretty, easy to get those back in?
Yeah. So because it is their particular sample, I mean, with us, there wouldn't necessarily be a problem. We wouldn't release or transport these if we didn't get the go-ahead from a treatment facility or the transplanting doctor anyway. So it would just be kind of the patient's role to have a look at what the process would be. But we have sent samples to the US, to Australia, to some parts of Asia.
Wow.
So I believe we're now at over 700 releases. So that continues to grow as well, just with the increasing kind of applications that are coming up now.
So what are some of the main applications for this? Because obviously people want to know if they're investing into it, what is it good for? Like, what can they use it for?
Absolutely. So as we had already discussed, these 50,000 transplants that have been done using cord blood, they are historically for transplant medicine. So the transplant to treat things like your cancers, blood disorders, metabolic disorders, and things like that. So a lot of people base their decision on what's the chances of them being able to use it for these particular conditions. However, as our science continues to advances, within the past couple of years, there has been a lot of research using these stem cells within regenerative medicine. So this is kind of a booming part of science now, where again we're using these cord blood stem cells to treat the body and promote self-repair and regeneration. And these are more so for conditions that are not necessarily fatal or life-threatening like cancers, but can improve your quality of life. So over 80% of our releases have actually been towards regenerative medicine. And some of the applications within regenerative medicine are to treat things like cerebral palsy, autism, and type 1 diabetes.
Wow.
So there is a high incidence of these particular conditions, especially nowadays. So that kind of opens up the market for using cord blood-based therapies for not just transplant medicine, but as a form, not just transplants, but as a form of regenerative medicine. So that's why more families are now seeing the benefits of storing it for the future.
And I know I've been to some of the various talks on cord blood collection, all of which have talked about the use for autism, even going as far as to say that there are cases where children who were previously nonverbal have now become verbal as a result of the use of the stem cells. So, and cerebral palsy, I haven't seen as much data on, but my understanding is you can have a reduction in the amount of muscle spasticity and some of those outcomes as well, which obviously is tremendous. I mean, we don't have anything in our medical armamentarium that lets us achieve those kinds of results.
Yeah, no. So cerebral palsy is a big one. We do have a lot of family stories where they have used either the child's own cord blood, so that's an autologous kind of infusion, or they've stored their siblings' cord blood and they've infused theirs. So there's a huge clinical trial going on actually at Duke University in North Carolina. So that's where most of our samples have been sent. And we have just seen amazing results. I believe they're now into phase 3 clinical trials. So they're just opening up the pool to a bigger group of candidates. So we're seeing improved motor skills and then improved cognitive function as well. So
yeah, that's incredible. I mean, we don't get those kinds of results from anything right now that's currently
right. Yeah. And, just through within the past couple of years, again, just by getting a bigger group of people, it's just allowed us to see better results as well. So
very, very cool. This has to be done at the time of delivery, right?
Yes. So we're only one opportunity to store, and that is at the time of birth. So that's why we kind of, work with obstetricians and doctors like yourself, Dr. Victory, to try and get that conversation going as part of your patient's prenatal education, just so that they're aware that this is an option, because there is, a bit of preparation that needs to be done beforehand.
Right.
And but it is only at the time of birth. Correct.
Okay. And there is some finesse to doing it because there's a bit of training that goes into it. So the cleanliness of the cord is imperative. We have to sterilize it, and you give us these cute little cleaning brushes, but it has to be sterilized, and we want to maintain the sterility of the procedure. So make sure, and this is from me to all of our viewers, that your OB is actually familiar with the process and to some extent familiar with the kit from inception. All of the companies are relatively similar, but you want to make sure they know exactly what to do and that they're very sterile in the process. This cannot be contaminated or your sample can be compromised, right?
Correct. So, and I mean, it's less than 1% where we would find samples contaminated and not good for storage, because we do kind of allow for normal bacteria, especially if it's a natural birth. But yeah, so that's another part of our clinical educator's role, is to just kind of remind our obstetricians to, you know, the best practices for cord blood collection, just so that you have an optimal sample for when you want to use it as well.
Awesome. Can you give us an idea of the cost for doing this?
Mm-hmm. Yeah, absolutely. So regardless of if you want to do cord blood, if you want to store cord blood only or cord blood and cord tissue, there are some initial fees that need to be taken care of within the first year. So this kind of covers the lab's processing and testing of the sample. So we will always do that as soon as the sample gets to our labs, and we want to obviously make sure that the samples are viable, we have a great volume, we have the certain amount of stem cells that reach our threshold. So we won't store any samples that, you know, don't necessarily meet the criteria. So that covers that particular cost. So if you want to do it for cord blood, it's roughly around $1,100 for that initial cost. And then for cord blood and cord tissue, it's around $1,795. So that can also be split into installments as well, so you don't necessarily have to pay that off. Yeah. Okay. So, and then just depending on what your the storage plan that you opt for, there is a storage fee as well. So the most common one and the most basic one is the annual storage fee, where you just pay a storage fee per year for however long you want to store it for. So for cord blood, it's around $153 once a year. And then for cord blood and cord tissue, it's around $291 a year.
Okay. And one other question that people frequently ask is, again, I'm getting into the almost grandfather stage now. So if I have a grandchild and we have one of them do it, and then a second one is born, and let's say we don't get a chance for whatever reason to do it for that one, can the cord blood from one child be used for another?
It certainly can. So there is a potential match between biological siblings. So the matching criteria is based on these HLA blood markers. So depending on what the matching criteria is set by the transplanting doctor or treating physician, there is a potential match between the siblings. So the child can obviously use them themselves, 100% match, and then there's a 75% partial match between biological siblings.
Oh, wow.
And then there is a 50% half match to the parents. So it's not only used for the child, there's potential for immediate family to use, to use blood as well. So, you know, we obviously recommend storing for all children, just so that you have a bigger pool of stem cells, because it becomes interchangeable. But again, you know, for some parents that didn't necessarily know about this option for their first child, and then they've learned about it for their second, they can definitely have the option to use it for the first child as well.
Okay. We have a question from Instagram, which is, what happens to the cord blood if the cord blood bank goes out of business? So I'm going to jump in there and say that Inception is owned by Cooper, and Cooper is a juggernaut, multi-billion-dollar company, which is not going out of business, guys. So I don't think that's a concern. But Imogen, go ahead and answer from a corporate perspective.
Yeah, no, and it's a common question that we ask, especially, you know, when we kind of get into the brink of the process and parents need to make that decision. But as Dr. Victory say, one of the main things, and I guess this is where when parents do their research on which particular bank they want to go with, you do need to kind of look at the financial stability and also the sustainability of a cord blood bank, because you are intending to store these samples well into the child becomes an adult, right? So again, the great thing about Inception Life Bank is that we have been the leader in the market for several years now, and we do continue to keep growing. But if in the rare occasion that the cord blood bank does go out of business, thankfully we are governed by Health Canada and by FACT, and they're kind of just like the gold star that kind of audits cord blood banks, make sure that they are compliant. So they would just make the executive decision on whether, let's just say Inception was to go under. There would just be another entity that would take over, for example. Right. But it's not like we would do anything physically to the samples themselves.
Yeah. It's as secure as you could ever possibly ask for.
Yes.
Are there any other questions from the audience in regards to stem cells? We've kept Imogen for quite some time, and I apologize it took a while to get over.
No, it's my pleasure. Not a problem.
Yeah. Any questions from anybody? T, do you have anyone that's asked us anything? You can message me in that private chat if there's anything else. We have a whole list of questions, Imogen, but they're all fertility things people want to know about.
That's totally fine.
Yeah, I don't think you want to try answering those ones. Anything else you want to tell us about, about cord blood banking or about Inception as a corporation before we let you go?
No, so I mean, thank you so much for having me on here. I mean, one of the main things that we try to do, especially as clinical educators, is to kind of try and bridge that gap between patients or parents and healthcare providers, just about knowing their options for cord blood banking. As we said, sometimes you only find out after the fact. So it is Cord Blood Awareness Month this month. Hence why Dr. Victory was so willing to have me on. But yeah, if you have any other questions, just anything in general, my email will pop up soon. I think Tarek has a little handy dandy thing there. Perfect. So if you do have any other questions, just feel free to reach out if it's about costs, the actual process. But yeah, all we want to do is kind of give our patients or your patients enough information just about their options on newborn stem cells.
And if patients just want to do it, what's the best way for them to access this? Just through the website?
Just through the website. So inception.com. If you want to do your own research just about us and our history, and even check out some family stories. So it's inception.com. We also have a chat there as well that you can kind of get live answers also. So yeah, and then the whole enrollment process is all done online. It's about a 10 to 15 minute process. We send you the cord blood collection kit directly to your home. So you keep this with you up until baby's delivery. And then your obstetrician at the hospital will do the rest. And then we'll get one of our medical couriers to pick up the sample and transfer it to our labs. And
on the off chance that someone misses the opportunity to, prepare all of this and get the kit sent to them, most facilities now have either a person or a storage site where they can actually access an emergency sort of kit, correct?
Yes. So most hospitals do have emergency kits on hand. So we tend to stock them quite regularly. Right. And in your case, Dr. Victory actually has them in his clinic, which is great. So if it does become a last minute decision, you go into early delivery and you don't have your own kit, absolutely, you can also reach out to us anyway, and then we'll be able to check and facilitate that from Dr. Victory's office for sure.
We got another question. What are the benefits of cord blood for type 1 diabetes? Do you want to take that one?
Yeah, great question. So it is still in clinical trials. So what the clinical trials are, so there's one in Australia actually where they essentially flag. So if somebody does want to store their child's cord blood, as part of their medical history questionnaire, we ask if any of their immediate family are diagnosed with type 1 diabetes. And essentially they can go into this clinical trial more as a form of preventative measure. So if during the clinical trial we see that there is, we screen for type 1 diabetes markers, we can use the cord blood as a form of preventative treatment so that it delays the onset of type 1 diabetes.
Oh, wow.
Or yes, so it's more of like a preventative kind of measure in that case. Still very early stages, sorry. But it is more of a preventative medicine in type 1 diabetes cases.
Yeah, and I know some of the early studies demonstrated that they could reduce or temporarily eliminate the need for insulin, but then it came back again. So I think longevity is part of it. And for people that are interested in this stuff, the stem cell companies including Inception, are working with other companies that are learning to expand the number of cells, to multiply the number of cells. So this will have huge benefits because if we can keep kind of increasing the cells or cloning the cells, this will provide us with a much larger store and supply of them than what we would get from just one.
Exactly. So they can use it multiple times for multiple treatments, and that would be something that would be applied to kind of this case with type 1 diabetes. Yeah.
Very cool. Well, thank you so much for joining us. We greatly appreciate your time. Sorry for the technical glitches.
My pleasure. Not a problem at all. It happens. Live TV.
Yeah. So it's Inception with an SC. So don't think of the Leonardo DiCaprio movie. It's INSCEPTION. And the SC is for stem cells. So it's easy to remember. So inception.com, and it's Imogen Santos if you want to directly get a hold of Imogen. And if you guys have questions, feel free to reach out to her and she will happily answer any questions you have. We do talk to all of our patients about this 100% of the time because of the fact that there was actually an OB out west that got sued for not telling their patients about it. So now we're just super cautious and we
yes, because it is part of the guidelines. But again, it's my job to also remind, because there's a lot of things, especially for first-time moms, a lot of information you guys are providing. So that's why we're here to help too. So
awesome. Well, thank you so much for joining us.
My pleasure.
All the folks at Inception, and I'm sure if there are more questions, we will get you back on soon.
Absolutely. Thanks so much for having me. Take care.
Thank you. Take care. Bye now. All right, T, are you going to read out the questions?
Yeah, I can do that.
All right, go for it.
How long do you recommend staying on progesterone support for IVF pregnancy?
So IVF pregnancies are at a higher risk of having preterm labor. So we keep our patients on it straight through till 36 weeks. Now, that is not the norm. Most people or most places are not doing that, but we do it and it seems to work quite well. So I've been doing that for a very long time. We have a very low rate of preterm labor. So we're quite happy with doing that and we'll continue it for now until somebody demonstrates we should.
Just received news today that my first FET with a euploid didn't work. 38 years old with no health problems, in good shape. Husband 52 is devastated. We have 3 euploids left. Do we still have a chance?
Oh, for sure. I mean, we know that even with the best centers, not all euploid embryos work. We don't know why they don't all work. I mean, I think there are ideas, but we know for sure that they don't all work. So the big question is, how many do you need? So there's good data from Richard Scott's group, which demonstrates that there's in their lab, there's about a 50 to 60% chance with one embryo. When you get to 3, you have a 95.2% chance. And when you get to 4, you have a 98% chance. So yes, if you have more euploid embryos, you have a very, very good chance overall. So I wouldn't be worried. Now, do I want to keep transferring euploid embryos without knowing why it didn't work? I don't, because our success rate's actually much higher than 50 to 60%. So I want to know what's wrong if it doesn't work even after one try. But there's nothing wrong with trying again. I mean, some people would just say, in fact, Richard Scott's group says, don't bother doing any fancy tests, don't do any fancy treatments, skip all the immune stuff, skip all the infectious stuff, just keep transferring euploid embryos until it works. That's fine if you've got insurance for it and it's not costing you anything. And I don't mean it just financially, I mean emotionally, physically, financially as well. But if it's costing you something, then you really need to think about that and reconsider, whether or not you're going to do additional testing or treatments. But there's definitely a very good chance of success, no question.
Also had lap suffer for mild endo. Is that AMH one you would work with for IVF? About to order the Fertility testing, but wasn't sure if the number above affecting moving forward with IVF.
What was the AMH? You're missing the first question from whoever that was. She must have said my AMH is blank. I can't scroll through the questions.
I don't see it. No, it's not there. It's not there. All right, we'll go to the next one and see if it comes back. Yeah. Does bowel endometriosis affect fertility or only if it's on the reproductive organ?
No, any endometriosis affects fertility because it causes immune inflammation and reactivity. And so if your immune system's overactive, you're going to compromise your fertility. So there's no question it has a huge impact. I can't believe how scruffy I look. I apologize for not shaving, everyone. It's not my normal style, but this is actually my holiday week.
It's the rugged cottage.
It's the rugged meat.
Yeah.
All right, fire away.
Hi, Dr. VNT. I had finished 3 months of Lupron letrozole and the extra 5 days of letrozole.
Okay.
Day 7 and lining is only 5 millimeters.
Yeah.
You have mentioned adding a teeny bit of estrus. Is that just until the lining has thickened, or do you continue until FET and beyond?
It depends. That's a great question. It depends on how thin the lining is, how thick it gets, how high your estrogen levels are, your body type. Are you really thin? Are you normal? Or are you on a little bit on the heavier side? So there's a number of different factors that go into it. But basically, we tend to continue the estrogen once we've started it as an overall kind of message. Yeah. And just to go back to that question about the AMH for the individual that we couldn't find the first half of the question for, we don't care what your AMH is. AMH is not predictive of outcome. That's been shown a million times. You can have a rock bottom AMH and still succeed. It's not easy, but it doesn't predict success. So, it's totally reasonable to continue trying if you want to try. Is it, going to take multiple tries? I mean, depending on your AMH level, yes. But is it reasonable? I mean, that's up to you. If you know the numbers and you know the stats and you want to try, we try.
Hi, Dr. VNT. Please review options for thin lining, thoughts on electrical pulse pelvic therapy, and any thoughts on acupuncture and Chinese herbs to thicken lining. Thanks.
Yeah, so acupuncture and Chinese herbs work. We know that there are studies on that. I've never heard of electrical pulse therapy to your pelvis, but it sounds horrible. So I'm not sure I would do that. It sounds like something out of a torture movie. So yeah, I don't know about that one. I've never looked it up. I don't know if there's any evidence for doing something like that. Other things that work, PRP, Neupogen, human growth hormone, vitamin C, D, E, all of those work together. Aspirin can work. You've already mentioned the acupuncture, that's good. There's something called pentoxifylline that can work. And then the other one that has shown some benefits are vaginal Viagra. I'm not a huge believer. I've tried it multiple times. It didn't really seem to work that well, but yeah, it didn't make it for me. That question came back again from Natalia. Natalia, please let us know what the AMH was. Just post a message with just the AMH. But I did answer it, which is we would work with anybody. So, and any AMH, it just depends on you knowing what to expect from it.
What is the success rate with IUI for a 45-year-old? Is IUI or IVF more successful for this age group?
Well, IVF is always more successful, but you need a long talk before you start spending money at 45, because in theory, you will need multiple cycles of IVF to succeed. So it's not something you do, hey, I'm going to try once and then, expect it to work. At 45, if you do the calculations, you're probably looking at doing at least 3 cycles of IVF to just get one normal embryo. That's if you have average hormones, average ovaries, and so on. So as long as you know what you're getting, we're totally for it. But if you don't know what you're getting, don't be led down the garden path, so to speak, by a fertility clinic that just says, yeah, keep coming, or just try and see what happens. As far as the IUI success rate at 45, negligible would be the right answer. It's probably less than 5%. So it's not high for sure. It's very, very low. And the miscarriage rate is over 50%. So you'd have to be really cautious about jumping into that. Not that you can't, it's completely legitimate to do. And actually, sometimes I recommend it over doing IVF because it's way cheaper. And there is a law of diminishing returns. I mean, at 45, your IVF success rate's only about 10%. So if you can get 3 to 5 with IUI, why not try? It's a hell of a lot cheaper. So I'm a believer in at least offering that option to people, but you got to know what you're getting. I mean, we're talking single digits for all of this stuff, so it's not great. Candace asked, what is the timing for PRP to thicken the lining? So it depends on who you listen to. Some of the studies just did 48 hours, but a lot of people are saying it actually takes a full month. So you do it this month, and then it's the next month that actually works.
Dr. VNT, thanks for all you do. In letrozole FET cycle, if you choose to trigger, when do you start progesterone, and how frequently do you check levels for endo patients?
So if you choose to trigger, you would need to start progesterone. You can still start it at the same time, but it depends on when your clinic is going to do your transfer. So if you're triggering, most people are going to go full natural, which is basically the trigger time plus 7 days. If you want to just start your progesterone, you can do it after 5 days. But if you're triggering, you have to be very careful with your progesterone levels, because your corpus luteum will make progesterone, which causes it to rise, and you're taking progesterone, which will cause an increase. And so you'll have a super number, and I don't mean super in a good way, like an excess amount of progesterone. So as your natural progesterone goes up, the synthetic progesterone you're taking has to go down so you maintain a level. And so make sure they're monitoring it pretty frequently. We typically will do it on day 3 of progesterone, like measure the level on day 3 of progesterone, and then either on the day of transfer or the day right after. We don't check it again after that.
A friend of mine, okay, this is pretty long. I'm sure you can see it. This is a long one. A friend of mine's clinic had her come in and do blood work on day 9 of a 5-day frozen embryo, and the blood work was positive. The test said 66 was the count. She then did a early response test, and then Amazon Cheapy the following morning, day 10, and both were negative. She was only doing the urine test to add it to a baby book later. She's wondering how that's possible and if she should be worried. She didn't do a urine test prior to the blood test, so she has nothing to compare it to, and no bleeding or any issues, and still has pregnancy symptoms.
So very few tests are accurate that early into a pregnancy. So I would not count on any of those home tests at all. I would ignore that. and just continue doing everything normally and go speak to your doctor if you're concerned. But certainly those tests we know for sure are not accurate. In fact, Tarek and I started doing a video on this years ago. If you read the fine print, it says it's only 67% accurate. So 2/3 of patients will get a result, but 1/3 of patients will not. And it doesn't mean you're not pregnant or things aren't going well. It just means the test is flawed. And even if you had, God forbid, a miscarriage, there's no way your beta would drop off that quickly overnight. So I would ignore that urine result. It's irrelevant, to be honest with you.
Do you recommend the Emma and Alice test if you have endometriosis? Would chronic endo only affect the transfer, or could it also affect your egg quality and fertilization?
Yeah, so we know endo affects egg quality and fertilization. I don't believe in Emma and Alice, only because I'm not a fan of genomics. And I find the report lacks the specificity that I want. So we use a different company, but I like the idea of the test. I just don't like their implementation of it. But endo definitely affects egg quality and fertilization.
Question from Instagram. Now,
sorry, one sec. Now, the fact that you have endo has nothing to do with Emma and Alice. Emma and Alice are for infections. Endo has nothing to do with that, at least up until recently. They do think endo is caused by an infection now, but that's very, very recent. So we don't look for endo in infectious cases or vice versa. They're separate issues. Yeah, go ahead.
How do you feel about sleeping on the back during pregnancy? When does it start to be a concern, and what are the recommendations? And this is from Instagram.
Yeah, so after 20 weeks, your uterus goes above the level of what's called the bifurcation of your major vessels, your aorta and your inferior vena cava. And your aorta is under pressure because your heart pumps and the blood goes through. And even if there's something on your aorta, it won't impact it. But your inferior vena cava is the main vein that brings blood back to your heart. And that can close off under pressure. And so if the uterus flops on your inferior vena cava, it can occlude it. And then what will end up happening is you'll start feeling lousy even if you're asleep. And the problem with that is your body realizes you don't have enough blood flow, so it stops sending blood to everything but your heart and your brain, which obviously is going to compromise the baby. So after 6 weeks, after 20 weeks, you don't want to be flat. On your sides, one side or the other, doesn't matter. Right side, left side makes no difference. But you got to be at least 30 degrees on an angle. So we tell our patients to put wedges behind them so that they can't turn over flat.
Hey, both. Thank you for everything, Dr. Victory. I had amniocentesis test done on me today, and I feel a lot of pain. Can I take Tylenol?
I'm not going to address that specifically because that's a medical question I can't answer on social media. But I will say Tylenol, to the best of our knowledge, is safe in pregnancy. There is one study showing that it may increase the risk of autism, but it's just one study, and I don't think it is enough for us to base anything on. But if you're having pain after an amnio, you need to talk to the hospital and get advice from them because there can be complications from an amnio. So make sure you call the obstetrical triage and they should have an answer for you.
36-year-old, 6 failed IUI, 1 failed IVF cycle, which had 13 eggs retrieved and only 1 embryo out of it that failed. Wow. Would you recommend another IVF cycle, or will retrieval end up being the same?
From Tina. Yeah, Tina, I would need to talk to you in person and see what happened. That's very unusual. So I need to know health habits, body mass index, what's he like, or at least the sperm source like, what's your health like, smoking, drinking, drug use, vitamin intake, what kind of protocol did they use, how long did you go for, what's your age, all of that stuff. Oh, we finally got Natalia to answer, I see. So her AMH is 1.68 nanograms. Oh, yeah, of course I'd help with that. That's a very reasonable AMH. Yeah, give us a call. We will happily help you out. That would be totally reasonable.
On TikTok, hey, Dr. V, if my DHA levels are 196 mcg, range 15 to 207, Should I stop taking DHEA with ER in August?
Yeah, I don't know why people are getting into this phase of measuring DHEA levels. We don't measure them. Like, we don't pay attention to that at all. It's not important. So I would ignore that completely and continue taking your DHEA regardless of level. We don't monitor levels. So, I mean, talk to your doctor. I can't answer a medical question like that for you, but we don't have a concern with that at all.
In what circumstances, this is from Instagram, do you recommend a Neupogen wash?
Thin lining, multiple previous failures, NK activity, recurrent miscarriage is being shown to help for all of those. Unexplained failure.
They think endo is caused by an infection now. Say more. Thinking face.
So there's a study out very recently. In fact, I think we talked about it last week on the show, demonstrating that a specific bacteria called fusobacteria was very common in women that had endo. I think they said something like 2/3. So it doesn't explain all endo cases, but they showed a much higher prevalence of endo in the women that had this bacteria than in the women that didn't. And so now they're saying maybe it's triggered by this bacterial problem. So who knows? We're not sure, but very interesting new study, critical, but we'll see. I think a lot more research needs to be done on that. And full disclosure, these kind of, oh my gods, show up all the time. Years ago, one of the smartest people in the fertility world, actually the founder of Inception Life Bank, thought he had figured it out because he thought there was a specific protein which made it stickier for cells to attach. And he thought when you had higher levels of this because of a specific mutation, that's what caused it. And they were like, yes, we finally figured it out. And then they realized, no, they didn't figure it out. So we get these sorts of things all the time. The whole BCL6 with Receptiva DX, it's the same thing. None of these oh my gods with endo are going to ever come to fruition. So or at least not yet. So don't get too excited about finding out answers. We got a long way to go before we figure it all out.
I was the glossy egg case from 2 weeks ago. You said to get a second opinion and suggested I reach out. Haven't heard back yet. Started my pre-treatment for second round of IVF. Could I still hear from you?
Yeah. So, I mean, reach out to info@drvictory.com. I definitely recommend not moving forward till you've had that second opinion. We are super busy. We try and get to everybody as quickly as possible, but it does take time. So, and obviously we can't jump the list. So my recommendation, be patient. Don't jump into another IVF cycle till they figured it out, because you really need to know what that whole glossy eggs meant. So I would want more info, but just email info@drvictory.com and they will get on it and book you an appointment.
What is your stance on immune protocol? Is it worth testing? I hear it's controversial.
It is controversial. So there are believers. I'm one of them. There are non-believers. There's lots of those. The data is, in my opinion, very much there, but indirectly. So is there a study that says if you take this, this will happen? Yeah, but they're not great studies. So that's the problem. There are lots of these little studies which show that there's a benefit to taking this and there's a benefit to taking that. And in this situation, if you use this medication, it works. And in that situation, that. But then, no one's doing those big randomized controlled trials. And those big randomized controlled trials don't work because, especially where immune stuff is concerned, immune related factors are very, very complicated and very individual. So it's not one size fits all. Everybody is different. Yeah, but I am a believer. Keep in mind, there are entire journals, in fact, there's 2, dedicated just to reproductive immunology. So it can't be like it has no impact. And we, even the guys, Richard Scott, I've heard him say it himself. he doesn't do any of that stuff. He won't use intralipid. Well, he does use intralipids, but he doesn't give any of these, immune treatments ever. He says, just keep making euploid embryos and transfer. Sooner or later, you'll be successful. And I get it. I'm not arguing with him. It's probably true. It's just not financially reasonable for most people. But the reality is, even he will tell you, they know the immune system is critical. We all know that. We know that the immune system is necessary and a huge part of a successful outcome. The problem with it is we don't know what we need to do to fix it, or which treatments work and which ones don't, because they don't have good data on that yet. Yeah.
What is the optimal TSH level for FET and why?
Less than 2.5, because it optimizes neurodevelopmental outcomes in the fetus.
How can I success first time try for IVF, and any tips?
You missed the one right above it, but I'll get that one. How can I be successful first time try of IVF? Find the right clinic, optimize your weight, make sure neither of you are smoking, drinking, or using any drugs, including marijuana. Exercise daily, stay away from everything bad, keep your stress level as low as possible. I know it's impossible to be stress-free. Those are the basics. Yeah, the most important part is getting a good clinic. Yeah, someone right underneath that said, go see Dr. V. I'm not going to toot my horn. I just like helping people here, guys. This isn't the Dr. Victory show. Do you have any info on Ozempic and such meds used for weight loss and its connection to fertility? Yeah, so listen, I'm not a fan of Ozempic. It causes people to lose lean body mass as well. So that's muscle and bone. So it's not a great medication. Yes, it does help you lose weight quickly, but I'm not a big believer in it. Weight loss, and we've said this 1,000 times, is math. It's not easy math, but it is math. If you take in less calories than you burn, it's biologically impossible not to lose weight. It has to be done safely. You can't be passing out and starving yourself. You need the advice of competent physicians and, allied healthcare workers like dietitians and, like people that are going to be helping you at the gym and so on. But it's math. If you're in a calorie deficit, so what you take in is less than what you burn off, you're going to lose weight. It's physically, biologically impossible not to. What's difficult about it? It's hard to get into a negative deficit, right? So I'm very proud to say I had a horror moment back in January when I stepped on a scale in a hotel in Ireland, in Dublin, where I realized I was the heaviest I had ever been. And since then, I've been doing a reasonable amount of exercise, and more recently. So I do 100 push-ups every day. I do 100 sit-ups every day. And then now I've added in some other stuff in the meantime too. I lost 20 pounds. I'm now back to where I was when I was 35. So it's very doable. In fact, when I was 30, I think. So it's very doable, but I'm eating way less than I used to eat. T and I are being a little more careful when we have dinner together. And I'm missing dinner with you tonight, buddy.
I'm not even eating because you're not here.
I'm currently starving too, because I totally came to this show late. And then I exercise. So I've given up a lot of the sweets. I'm keeping myself in that calorie deficit, and I'm doing a lot to build muscle. And remember, the more muscle you build, the less that you need to be careful with your calories, because you need more calories to maintain the muscle. So if you bulk up on muscle, you're going to end up getting a little more leeway with how much you cheat. We got a Carly question. Should I work out after FET or take a few days off? Take a few days off if it doesn't stress you. If it stresses you not working out, work out, but don't go crazy. Keep your heart rate reasonable and no straining or heavy lifting and that kind of stuff.
Okay. How long from consult to start of IVF cycle at your office?
It depends. We triage each case individually. So if you're 43 and your AMH is low, we're going to bring you in right away because you have no time. If you're 27 and you just started trying, we've got some time. If your AMH is reasonable. So it can be, I've got one lady that's, saw me and is ready within a couple of weeks. And I've got other people that need several months to get ready. So it's, going to be dependent on your particular instance and your circumstances. Someone's asking if they can see you yet.
I'm way too casual today.
Yeah, you're casual. I'll tell you about how casual I am after. But we're going to bring T on. T and I are working on a new setup for the show, and he's going to be on. So lots of thumbs up for T. We love T. So we're going to bring him out of the dark soon.
The MTHFR gene seems to be controversial. Do you think it increases blood clots, infertility, and miscarriages?
I do. It is controversial, but I think there's enough data to believe in it. So yeah, I believe in it. Does it help taking methylfolinic acid, which is the recommendation? I'm not sure. But aspirin and heparin, yeah, we definitely use that.
Yeah. Priming for egg retrieval with you. Hubby got sick. How bad is 1 day of fever for sperm?
Oh, it can be bad. So you can always come in between to get checked out. And if we have to delay, we'll delay.
What do you recommend to help to increase your chances for a successful egg retrieval or transfer? Does acupuncture show benefits for success?
So what do I recommend? Use the letrozole protocol, keep your estrogen low, take lots of vitamins, keep your stress levels low, no smoking, no drinking, no drug use. Get a very detailed evaluation, make sure they're monitoring everything on you carefully. And then just have a really good transfer, I guess, after that. Acupuncture is controversial. So there are many studies. The majority show some potential benefit, but it's controversial. So what we tell people is if it stresses you getting jabbed with those pins, don't do it because it'll probably be worse. But if it relaxes you, make sure that you go for it because that's probably a benefit. Are you seeing the YouTube from Mandy?
Yeah, I saw that.
That's funny. You know what? I didn't even remember we said that. He is coming on. We're going to bring him on. We got to figure out the right setup because it requires multiple cameras and microphones and all that stuff. So it's going to take us a little bit of time, but we're going to get there.
Do you still do the interlipid infusions like I got for the NK cells? I think that really helped me.
Yeah, we do. Yeah, for sure we do. Yeah, we do interlipids all the time. Yeah. Okay, we are at 9:13. So I think I'm going to wind it down. Okay. Thank you all for joining us. We will be back next week with another show. And hopefully we'll have a good article by then. I don't think there's anyone on that show yet. But we have some exciting people coming on in the next few weeks. We have a fertility coach that's going to be joining us. We have an amazing urologist from Miami who is going to fill you in on all sorts of things about sperm that you probably didn't even know. And he's fabulous. Really, really great guy. And then we have Nathan Treff, who is kind of one of the fathers or gods of genetics. And he's going to talk to us about PGT. And should we do it or should we not do it? And how should it be done? And is it worth it or not? And all that stuff. So, and how many false positives there are, which was shocking from a recent conference I went to. So yeah, T, thank you for your patience. Maybe stay on after we close the show, or do you want to just call me? And thank you everybody for joining us. We'll see you next week on Fertility Fact or Fiction. Welcome to my cottage. Have a good night.